A very pleasant good afternoon to all of our viewers. Welcome to another edition of Let's Talk. We are, as usual, very delighted that you have chosen to join us this afternoon. And we have this very exciting program. We are talking today about menopause, another in our series on taboo subjects impacting especially females, but also very significant and important for men. And I really do hope that the males are on this afternoon, especially the married men. You need to be on. Ladies, if you are on and your husbands are not listening, please call them up, let them know that Let's Talk today is a Let's Talk that they cannot afford to miss. And you want them to be listening right alongside you, okay? No nudging, no looking at each other strangely saying, see, I told you. But today we have a very important subject. We are talking about menopause and how it affects relationships, particularly the marriage relationship. And we have two very special guests with us this afternoon. One, no stranger to us and needs no introduction. She has been on Let's Talk often enough. It is my delight to introduce to you this afternoon Dr. Monica Osborne-Stevens. She is the medical director of Moss Medical here in Antigua. We're delighted to have you back, Dr. Stevens. Good afternoon and welcome.
Good afternoon, Dr. Greene, and good afternoon to all listening audience and also my co-panelist, Dr. Garraway. I'm looking forward to this interesting talk that impacts each and every one this afternoon.
Okay, wonderful. We have as our second special guest this afternoon, you just heard Dr. Stevens call the name there, but in case you weren't paying attention, as our special guest, we have Dr. Jefferson Garraway. He is an experienced medical practitioner with over a decade of experience in the field of medicine. He is currently the senior medical officer with the Ministry of Health here in Antigua, and it is my delight to welcome Dr. Garraway for the first time to Let's Talk. Good afternoon, Dr. Garraway. Welcome to Let's Talk.
Hi, good afternoon. It's actually my pleasure to be part of the program, and I look forward to this very important discussion this afternoon.
Oh, wonderful, wonderful. Well, we are going to have a word of prayer for those of you who are viewing or listening. We invite you at this moment just to pause for a word of prayer. Almighty Father, be with us as we go into today's discourse. We ask for your wisdom and your guidance. In Jesus' name, amen. Well, friends, we have a packed program. As usual, 1 hour runs by very, very quickly. And so with our guests, we are talking today about menopause and how it impacts relationships. We continue our discussion on taboo issues impacting, I did say, especially females. Our discussion today, menopause, is one that I do believe strongly, firmly, that both males and females need to be mindful of this. Now, some persons refer to this as a woman's issue. Even before we get into what exactly menopause is, it is important. And that's my opinion, but I want to hear from the medical professionals. Is this important for males? Should men turn off the channel now and say, this is not for me? I will listen next week when you come back to talk about something else. Doctors, respond to this for me, please.
Okay, thank you, Pastor Greene. I'll start by answering this question, and it's a very excellent question to begin with. And of course, males, stay right there. Do not move. As a matter of fact, call your friends to join you, because Pastor Greene and the listening audience, it is as important to female as it is to the male. I'm going to give you 3 reasons. Number 1, if a man is educated on menopause, he can be a more supportive partner, because menopause can bring about a range of symptoms. And I'm sure we're going to talk about some of those symptoms this afternoon, like hot flashes and mood swings. And understanding what a partner is going through can help create a more supportive and empathetic environment. So if you're there for your spouse, when she is facing this, you're able to support her emotionally and otherwise, it will bring benefit to you in the relationship. Also, you'll become a better communicator, because, for example, irritability and depression, women can experience these side effects, these symptoms, during menopause. And if you understand exactly what the woman is going through, you have an idea when to communicate certain things and when not to communicate certain things to her. It also helps with the family dynamic. So if the male understand that, okay, my wife is going through menopause, and for example, there's a teenager or adult child in the house, then that spouse, with the understanding of some of the symptoms that menopause can cause, can be that go-between if there's some sort of friction in the family at the moment, because he understands exactly what the female is going through.
Yeah, and I would also like to join my colleague, Dr. Osborne Stevens, and I would like to add to say that to all the men who are tuned in, I would like to encourage you to sit back and basically sit tight and call a male friend or call a family member so that they can also benefit from our discussion about the topic of menopause. So that as men, we can better prepare to support our wives, our mothers, our sisters as they go through this transition in their lives.
Yes.
Okay, now that's significant. Our wives, our mothers, or sisters. So we are talking about the men lending an understanding ear. And well, I guess we'll come back to that in a while. But Dr. Garway, let me follow up with this. Can you then explain what menopause is and how it occurs? I'm choosing to ask this to the man.
Yeah. Okay, so natural menopause is a biological process that occurs in women as they get older in age, generally middle age, right? It is characterized by the absence of menstruation for 12 consecutive months without any obvious pathological cause. Menopause actually marks the end of a woman's reproductive years, right? How does it occur? During the reproductive age of a woman, there is the ovaries, which is a structure of the reproductive system, produce what we call estrogen, which is responsible for the thickening of the inner lining of the uterus as part of the preparation for pregnancy. If pregnancy does not occur, then there is shedding of that lining, which is what we call menstruation, or period as we refer to it. As a woman ages or gets older, the levels of estrogen progressively decreases, and there will be a point where the levels will not be sufficient enough to basically contribute towards the thickening of that layer, and then we'll be absent from a period, or there will not be any menstruation. So basically, that is how it basically occurs, by the decrease of the estrogen levels. Yeah.
Now I want to stand this question for a little bit, and I'm sure Dr. Stevens, you may want to jump in here if you so desire. But I remember that last week we spoke about menstruation. That's one of those taboo subjects that people don't like to discuss out in the open. And I hear Dr. Garway saying that when menstruation ceases, when women, and in my own layman's way of saying it, when a woman can no longer become pregnant. Now, I know that he did say for 12 consecutive months. So that's interesting. Let's make sure we emphasize this point, clarify this point. Are we saying that there has to be 12 consecutive months before a woman can say for sure, hey, listen, yes, I'm getting into menopause?
Yes, that's definitely right. So Dr. Garway explained it well. So what happens, the diagnosis of menopause is actually a retrospective diagnosis. It means then that you have to look back and see if you have missed your menses, your period, for 12 consecutive months. So for example, if a woman misses her menses 6, 7, 8, 9 months, and on the 10th month, that period comes back again, it means then that she's not in menopause and she has to start the count all over again, because it has to be exactly 12 consecutive months without having the period. And I want to put a plug in here right now, just in case we don't get back to something like this. It is important for a woman to know this, because if after 12 months, let's say 14, 16, 18 months without menstruation, even up to 2-3 years, and a woman starts bleeding again, some woman would say, oh, wow, my period came back. No, 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 no. If that happens, it is considered uterine cancer unless otherwise proven. So once you clear 12 years, several more months pass, and then you start seeing it again, you have to get yourself checked out. Because women are born with a finite number of eggs. So as the years go on, and as Dr. Galway said, they get into their midlife, like late 40s, late 30s to early 40s, they start seeing the decline of the estrogen and progesterone, which would stop their menses.
Now I'm going to make things a little complicated. I don't know which one of you will respond to this. We are still on this question too. Or should I say second question, because I did ask a question before. So the matter of contraceptives, let's say the pill or the patch or the injection or whatever it is, these things can interfere with your menstrual flow, not so?
That is correct.
So how does this complicate the matter? And I know this discussion is not about contraceptives, but I'm choosing to ask it because last week there was a question regarding somebody not having their period for 3 months, and you know, I did not say this outright, but I thought maybe the person is using contraceptives. So if an individual is on contraceptives, how do they know that, hey, they're getting into menopause?
So generally speaking, what happens is that we will normally, when we are prescribing contraceptive methods to patients, we normally explain to them the benefits or the side effects, so to speak. And one of the side effects of some of the contraceptive medications are basically the irregularity of your menstrual cycle, right? So if a woman is at that stage in her life, right, there are also additional symptoms that she could also look up for. So it's not only missing your period, but if you are, there are also additional physical symptoms, which probably we would maybe get into later in the discussion, that those need to be accompanied with the absence of the period, so to speak.
Okay, wonderful, wonderful. Let me come back to you, Dr. Stevens. How long does menopause last, if there is such a thing as a specific time? And can you explain the associated terms, perimenopause and postmenopause? This is kind of wide, but do your best.
Okay. All right. So in terms of a timeline, you're asking about years, and it's very variable from woman to woman. But on an average, before a woman gets into menopause, she gets into a stage that is called perimenopause. And that perimenopause means the years leading up to your menopause, the years leading up to the stoppage of your period. And that time could be 2 to 3 years for some persons, and it could actually be 4 to 6 years for other persons. So you can look at that perimenopausal period could go from 2 to 8 years. And that could be a very long time for females if they're having distressing symptoms in their perimenopausal stage. And then they get to that phase now where they get to menopause, and that is stoppage. Once the period has stopped for 12 months, that is menopause. So after the 12 months, they go into now the postmenopausal stage. And that stage, again, that stage can be very variable from woman to woman, but it can last up to even 10 years in Black women, studies have shown.
You know, Dr. Stevens, you said quite a bit there. I'm going to ask you to just back up a little bit.
Okay. No problem.
So if a woman is, well, let me ask you this, and I did have a little lapse in my internet connectivity for a moment, so you may have said this, I may have missed it, but generally menopause starts at what time? Menopause
could start, okay, you're talking about the stoppage. The average age for the stoppage, which is the menopause, the stoppage of the period, is 51 years old. However, there's a range between 45 and 55. You still have some persons who can be out of that window and having menopause even as early as their late 30s. So it varies from woman to woman. But as I usually tell my female patients, a good guide is to talk to your mother or grandmother. It doesn't hold true all the time. However, if your mother said that, oh, she was late with menopause, she was close to 55, chances are you may have your menses around that time because of the hereditary influence, but you can still have it earlier. So 51 is the world's average. However, the range is between 45 and 55, but you can have women, because I have women have menopause in their early 30s. Before they hit 40, they were already in menopause. That was not contributed by surgery or by any sort of medications.
So can you help me again with the peri and the real?
Okay, so perimenopausal is the time, the years leading up to actual menopause. So the years that she starts seeing some changes in her menses. So she may start having some absent irregularity in the menses. So this month she may see it and next month she may not see it. It may change in terms of the flow. She may go from heavy to light, or she may have been light before and she goes to heavy. And then she may start having some hot flashes, some night sweat, problems with weight gain, or even problems with her sleep. And I know you're going to ask about those later on, and we'll go over them again. But this is the time she said, some changes are coming. I'm having some skip menses, having some irregularities, I'm feeling some different symptoms, it's coming. So that time period leading up to the actual stoppage of the period, when you get to that 12 months of no menses, that is the perimenopausal period. I hope I didn't confuse the audience there.
Well, I hope you didn't confuse any of the listeners. I think that was very clear, but I do have a follow-up question.
Okay,
I'm going to get back to Dr. Garwe in a moment, but because we're talking about menopause and its impact on relationships, I know that some women are career women and they're taking longer and longer to have children. Now, you are indicating here that there is this thing called perimenopause. And so are we saying that when a woman begins to get to around about age 37, 38, 39, it becomes rather difficult for them to get pregnant or to have children? And are there implications for what time a woman should want to get married and have children?
Okay, well, based on all the studies we have seen, a woman is more reproductive. She's more fertile in her earlier years. We're talking about early 20s up to early 30s. And those are the best years to have your children, because at the question you asked about after they get their children, if you decide to get your children late, let's say you have a baby at 37, 38, quite possibly a couple years after you can be in menopause, and you can see the implication for the family. While you're trying to help a child with their homework, going to preschool and primary school, you are experiencing all those hot flashes, you have sleep disturbances, you're irritable. So try dealing with a kindergarten child with their homework and hot flashes. So this is why women are encouraged to start their families earlier when they're in their prime reproductive years.
Well, let me ask Dr. Garwe to run through some of the symptoms for us. Doc, what are some of the symptoms? I know Dr. Stevens mentioned hot flashes and something else she said, I can't quite remember. But highlight some of the more common physical symptoms for us.
Yeah, so as Dr. Stevens was saying, the signs and the symptoms, they generally begin during the late perimenopausal stage, and they may vary or worsen as the woman approaches the menopause and even postmenopausal stage. So she may experience, as Dr. Stevens was saying, irregular menstruation. So there may be a change, meaning that the length of time between the periods may be longer or shorter. The flow may also change. It may be lighter, it may be heavier, and she may even be able to skip periods. right? Another symptom is basically the hot flashes, which is basically described as this sudden feeling of warmth in the upper body, which is usually most intense over the face, the neck, and the chest. The hot flashes can also cause persons to sweat a lot, right? Mm-hmm. And if you're losing too much body heat, you may also have chills, right? Another symptom that we could basically speak about is the mood swings. So the woman may experience feelings of anxiety, stress, depression, even anger and irritability, right? And due to the decrease in the estrogen levels that affect your brain and your body rhythms, which includes your sleeping patterns, the person may have difficulty falling asleep or even maintaining a sleep, right? There may be changes as well, such as your changes basically related to your hair and skin, right? You may have thinning of the hair. You may have loose or dry skin as well, right? And the woman may also experience what we consider to be weight gain, especially surrounding the abdomen due to changes in the metabolism, okay? Also, as a result of the decrease in estrogen levels, the individual may experience a decrease in sexual desire, and they may also experience vaginal dryness, which can cause painful sexual intercourse. So those are some of the signs and symptoms that may occur from the perimenopausal stage up to the postmenopausal stage.
Now, for men who are listening, and young men whose wives have not reached there yet, I imagine some of them may be saying, what are you saying? All these things, you're talking about hot flashes. You said the woman may feel too hot, and then you said chill, she may feel too cold. That sounds like a broken thermostat to me. You know, and then you're talking about hair loss, you're talking about dry skin, you're talking about problems with sleep. This seems to be a bunch of things, and mood swings on top of that, anger, and this seems to be quite a lot. Is there anything that prepares a woman for this? Do you tell people, hey, listen, this is what you have to expect, or women just run into this thing like a bulldozer?
Well, basically during a doctor's visit, normally your gynecologist could basically speak to you. Even the general physician, we could probably let you know exactly, you know, there's going to become, I've had patients who come to me and said, doctor, I have this sudden feeling of, I feel hot, just suddenly start to feel hot, and I just sweat. And, you know, so you use that opportunity when you have your patients to educate them and let them know that those are the symptoms, and that is basically why it's happening, because you may be at the perimenopausal stage. So those are basically educating individuals, and, you know, also maybe doing some level of counseling so that they'll be able to cope when those problems do come around.
Excellent. In addition, Pastor, if I would jump in here, this is why I'm grateful for programs such as this, as Let's Talk, because you talk about a whole lot of different topics, and menopause is something that is often not talked about. And menopause have a huge impact on women's life. There's some women who would have gone into retirement early because of the symptoms that she's experiencing from menopause. And that's why the support is very important. There's a secular song that says, blame it on the alcohol. Trust me, in those latter years, you can definitely blame it on the estrogen and the progesterone, because they have tremendous impact on not just the physical health of a woman, but also her emotional health.
Okay, now I have two questions. Well, there are a few questions, but I'm going to ask two at this time from the audience. I don't know if I did say to Dr. Garway that our listeners do ask questions from time to time, and I don't know which one of you will want to respond to these two questions. These are rather very interesting questions. I'm going to choose to ask both of them at the same time because they seem to me to be related in one way or the other. A person who has a period up to age 60, is that a problem? And then the second question is, when your OBGYN looks you in the eye at age 58 and says that your ovaries are still active, what is she saying?
So with regards to the first part of the question that asked about at 60 years, what happens, as Dr. Stevens said earlier on, the average age for menopause is basically 51 years, but give and take, you're dealing with different individuals. And I think she would have also mentioned earlier on that women are born with a certain particular number of ovaries, right? So that in itself could determine at the time of which the patient, actually the individual, started her what we call the menarche, which is with the very first menstruation. So if she had a very late start to her initial menstruation, the first menstruation, it's possible that she could basically be at 60 years and probably still have a menses. That's basically one of my thoughts on that first part of the question. I'm not sure if doctor wants to add any other.
Okay, before you add anything, I'll go on further. You're introducing something there that I want to pick up on. So let's go back. What I'm hearing you saying is that a woman is born with a predetermined number of eggs, right? We're going to use simple terms, eggs.
That's correct.
So if she has a late start to her cycle, to her menses, then she would most likely ovulate for later in her years. So it means therefore that one should pay attention to when they begin the series. I assume, again, out of what we discussed last week, that some children may have the period, don't know what it is, and they don't pay attention to it or when it begins, whether it's early or late. But this suggests to me that there are implications for when it is going to end as well. Am I correct?
Yeah, you could. I agree with you. I do believe that is acceptable. Yeah.
Dr. Stevens, you were jumping in with something.
Yes, that is true. Based on what Dr. Garraway said, that is completely true. However, I just want to add something else here. I spoke earlier about talking to your family members, your mother and grandmother, and have an idea how late they went. You mentioned the age of 60. We did say menopause is at 55 on average, and Dr. Garraway said definitely that's the average, but persons can go longer. But if a woman goes to 60 years old, instead of assuming that, okay, I'm still having my menstruation, they should get themselves checked out, because you can have an issue where you have something that is going on in the uterus, for example, uterine cancer, that allows you to continue to have that flow, but it's not actually physiological. So it means it's not your normal, something else that has come on board that you're not aware of, especially if you were that type of woman who have not been having her gynecological checks, meaning you have not been having your pap smears. So you're unsure about what is really going on with your body, because at that stage now you could have thickening of the lining of the uterus, and that can be a problem. So it's important for you to check with your doctor so that they could make sure that, okay, you probably started late with your menses, and so now the time for menopause has just lengthened.
Okay, very interesting, informative. We are about midway through this program, so we're going to try to rush on. Dr. Stevens,
I'm sorry. The other question, I don't think.
Yes, that's true.
I mentioned that. The gynecologist looked them in the eye and said, "What? You still have active ovaries or something?" Active ovaries, yeah. So it means, but you alluded to that, Dr. Greene. If they may have started late, let's say some persons may start even 15 and 16 to start menstruating. Remember, they have a finite number of eggs. So if you had 50,000 or 50 million, for example, and your eggs are being released every month because you're having your cycle, then it'll take a longer time for you to run out, so to speak, of those eggs before you get into your menopause. So the doctor was basically trying to say to her, your ovaries are still active. You're still releasing eggs monthly.
All right, we may come back to the symptoms, especially the symptom relating to sexual desire, because I did hear Dr. Garraway say that during menopause, not menstruation, during menopause, a woman seems to exhibit or can exhibit decreased interest in sexual desires, but because of the time, the way the clock is going, I want to get into some other things. Now, I want to believe that physical symptoms can also lead to emotional or psychological challenges. Dr. Stephen, I'm going to ask you to respond to this one. How, for example, does menopause affect a woman's mood? Well, Dr. Gower did say that there are mood swings. What are the implications for her marriage and particularly her desire for sex? You know, if as Dr. Gower says, there is a decreased interest in sex, she's married, the man may not be experiencing these symptoms she is, and he may begin to think, well, what's going on? You know, all of a sudden. Can you respond to that? The implications for
implications. Excellent question. But first of all, we go back to that estrogen, that very important hormone that is responsible for so many things that goes on in a female. And it has receptors on so many different organs, which is why it has when you have a decline in the estrogen, there's so many symptoms that a woman will face. The physical, we spoke a lot about the physical, but the psychological, the woman could have anxiety. Anxiety could stem from the fact that she's having vaginal dryness and her partner, her husband, wants to become intimate. I have known of some women who have told me as soon as they hear the car pulling into the driveway, they run into the bed and they put the covers over their head. Why? Because they have not had that communication. They have not explained to the partner what is actually going on. And when they have sex, because of the decreased estrogen, the vagina becomes dry, and that intimacy, that sexual act is no longer pleasurable. And so, of course, that is going to have implications on the marriage relationship, because the male is going to be wondering, why have you lost attraction for me? What is going on? Some females have even been accused of having an affair because they have lost interest in the libido, the sexual drive, all because the estrogen has decreased. Not only the anxiety, because of some of these symptoms, maybe lack of sleep. She has sleep disturbance in the night because what? She's having hot flashes. Those hot flashes, she can't sleep. Those night sweats, she can't sleep. And so it puts her in an irritable mood. It makes her feel depressed. It makes her anxious, and she cannot relate to her partner. She can't communicate in the most effective way, and intimacy declines.
So Dr. Stevens, before I go back to Dr. Gower, you're saying therefore that the loss of interest in sex, you did say vaginal dryness, but you did also seem to suggest that it's not just vaginal dryness, but there is just decreased interest. You know, I mean,
yes, because the sex hormones decrease.
Yeah. So Dr. Gower, let me come to you now as the male on this panel. I'm laughing. You are the male on this panel, so you're going to have to respond to this question. I want to ask if I understand correctly, menopause can challenge a woman's self-esteem. Some women have challenges with weight. You know, some may gain weight. They may be uncomfortable with that. There is hair loss. The hair is an important beauty element for women. Now, if she's married, what role can or should the husband play in all of this? What kind of support should a man be given to a woman while she's experiencing these kinds of symptoms?
Okay, so the first step is for husbands to learn about menopause. So getting yourself and others informed is an important step, as I mentioned at the start of the discussion. So education is key. Communication is also very important. And it is also important to always that the husbands be available so that women can feel supported, and to also help with their symptoms by encouraging them to maybe to take a walk, maybe go for a swim, maybe be active, generally speaking. Also, the husbands could show love, showing love and appreciation, offering words of encouragement can help make women feel more uplifted and even empowered, basically. So those are some of the things that men or husbands can actually do for their husbands during such a difficult time.
Now, because I'm a marriage counselor, I want to just jump in here to pick up on the first point you made there. This matter of knowledge. Knowledge is power. So a man understanding the issues involved. Last week, I mentioned that one of the alarming things for me as a marriage counselor is when I'm preparing people for marriage and you ask them certain questions on menstruation and when a woman can get pregnant, etc. A lot of times they give the wrong answer. And, you know, there are some questions. There's a question that I just spotted. How many eggs does a woman release monthly? Now, one of you may respond to that in a while, but information like this is important for men. I'm speaking to the men to understand the anatomy of the woman's body and the whole physiological functioning of the body, how it goes, so that you are able to give the support and you are not caught off guard. So I don't know which one of you want to respond to the question. I mean, I could answer it, but your doctors, your medical doctors, let me put it that way. Somebody's asking, how many eggs does a woman release monthly? Maybe I should ask the woman to answer that one.
Let me just answer that. It's simple. One, it could be two, but on average, it's usually one egg. One egg a woman can release.
Okay. But now there's another question. Let me ask this one. I mean, there may be lots of questions, but I'm, pulling here and there. A woman who had a hysterectomy at age 40, the question says, what is the impact for the body in terms of hot flashes, mood swings, and depression? Now you're going to have to begin by explaining what is a hysterectomy, because some women, some men, well, some listeners may not know.
Okay, I'm going to attempt that question. Okay, so a hysterectomy is the removal of the uterus, which is the major female reproductive organ. When we are talking about removal of the uterus, you can say you can do a total hysterectomy, meaning you take out the uterus along with the fallopian tubes and the ovaries, and that is called a total hysterectomy. There's some females, for example, the number one cause of removing the uterus, the number one cause of having a hysterectomy is uterine fibroids. So let's say the woman has uterine fibroids and the uterus is removed. Sometimes, depending on the age of the woman, the ovaries may be left. At other times, the ovaries may be taken as well in the total hysterectomy. So if that woman is, let's say, 38 or 40, and she has a hysterectomy, a total hysterectomy, it means that she is going to go into immediate menopause because you would have removed the estrogen which is responsible for her giving support to the rest of the body so she doesn't have these hot flashes and the mood swings. Once you leave the ovaries, she will have estrogen, so she will gradually decline in that hormone. However, if you take away ovaries, uterus, everything, she's going to immediately go into menopause.
So that's pretty interesting. Again, health is important, and it's very important to have meaningful communication with your medical professionals. I think it is one of the reasons why husbands and wives need to listen to Let's Talk. I want to read a comment in the chat because I think it's instructive. Many of the husbands become hostile. Wow, that's not a good thing. Become hostile when the wife does not want to engage in intimacy. And then the person says, please instruct our SDA husbands. Well, all husbands who are listening, please instruct our husbands how they are to behave during this period.
No.
But it's a serious comment. It's not a question, but it's a request. Instruct husbands how they ought to behave. And Dr. Garway's, shared some very important pointers there about supporting and showing love and that kind of thing. Dr. Stevens, do you have anything to add to that?
Well, this is a loss for the male as well. And this is why both of you have been saying it. We have been saying it since we started. Education is key. The husband needs to understand this is not something that the woman brought upon herself. This is a biological process that occurs with every female. And so understanding is very important. Intimacy, having intercourse will not be the same as when she was 25 or 35. So the males have to recognize she cannot give you sex every night, sometimes 2-3 times a week. It may be once a week. It may be once every 3 months, but you have to have that conversation so that you understand. And this is where you're supposed to say, okay, so honey, I've learned about menopause, but I read we can do this or we could do that. What do you think about it? Because there's certain things that she can do. So females, I don't want you to sit back and say, okay, I'm going to menopause. My husband is not going to get anything for the rest of his life. I have shut up shop and I'm done, right? This is why we're having this conversation, because there's things that a woman can do. But I must also hasten to say there's certain things that she may try and it may not work. So she still may suffer from that decreased libido and just does not have that sexual drive, have totally no interest in sex. And men, you have to be understanding.
We want to hasten on to come to the things that the woman can do. I'm sure the men would be happy with me asking that question. But before we get there, I want to get back to Dr. Garway in a minute. But Dr. Stevens, just another question. Because we were talking about women who are married. What about the woman who is not married? Are there support groups and resources available? Because, if a woman is married and her husband understands what is happening and he's supporting her. If a woman is not married, she's not sexually active, I'm assuming, she still will be affected by menopause because she's a woman, correct? So what kind of support is available?
Again, this is why conversations like these must be had, and they must continue to go on, because there are departments, churches that can help with this. 2 departments come to mind. Women's ministry. Women's ministry leaders are supposed to be bringing in health professionals and other persons who can talk about these sort of things so that they can educate the women. Because if a woman is not married, as you said, Dr. Greene, she's going to need some sort of support, right? And if the women's ministry is talking about these things, she can go to that ministry and get some help. That would be fantastic. Then you have the marriage clubs. We need to have marriage clubs in our churches, even in the district, if not one church. And during these marriage club sessions, talks like these are had. If you can't find it in the church, you can go online. There are some supportive groups and forums that you can go online and you can read and you can educate yourself. Don't be afraid. Read books. The information is out there. And if you read a book and you don't understand the information there are lots of healthcare professionals in the church that can assist you with questions if you go and read and you don't understand.
Now, just in the event that I don't get a chance to say this when we end the program, because of course at 4 o'clock there's another program. I want to just point out that next week we're going to be talking about breast cancer. We're going to have 2 other health professionals on. We're going to have an oncologist and we're going to have a surgeon as we discuss another very important subject, breast cancer. So again, husbands and wives and ladies, we want you all to be back next week. Now, Dr. Garway, I want to come back to you at this time. Another very important question. Are there long-term health implications? I'm talking about of menopause, such as bone health, maybe heart health. How a woman who goes through menopause, what are the implications?
Yeah. So that is true. I want to agree with you that there are indeed implications. And I would start off by saying that estrogen, basically, as we have been always speaking about this estrogen, this famous hormone, it helps to protect the cardiovascular system, the bones, the brain, even vaginal and bladder tissue. And as we know that this protection is actually lost after menopause, since there's a decrease in the estrogen levels, leading to the following implications. With regards to the, there's an increased risk for cardiovascular disease. And by that, I mean heart attacks and strokes, right? And cardiovascular disease is actually the leading cause of death in women over 50 years, right? Women may also suffer from osteoporosis, and that's another potential long-term implication, because after menopause, women lose approximately 1% of their bone density each year, putting them at risk for fractures. And those related fractures, secondary to osteoporosis, are the most common cause of poor health in postmenopausal stages, right? Bladder problems, such as the need to pass urine more frequently or are not able to retain your urine, that is another problem that women may encounter. Cognitive decline is also very common problem, because there is really not able to recall, so their short-term memory may be affected. They may also have brain fog, or what we call forgetfulness, right? So those are just some of the implications that basically happen as a woman reaches menopause.
Mm-hmm.
Very, very interesting. I'm tempted so much to follow up on a few of those things, but we only have 7 more minutes, so I'm rushing to this next question. I want to come back to you, Dr. Stevens. I believe that somebody listening here may want to know about treatment interventions. I've heard of hormone replacement therapy. Can you say how this works, and are there risks versus benefits?
Okay, excellent question. And I must hasten to say that the medical world is still a bit divided on this in terms of the hormone replacement therapy, because of some of the risk factors that I'm going to talk about based on the question you just asked. So the hormone replacement therapy, also known in the UK and Australia as menopausal hormonal therapy. So it's HRT or MHT. But it's a medical treatment that involves replacing the hormones that the woman has lost, particularly the estrogen, but you can replace the progesterone as well, because these hormones are being decreased. And once the hormones are being decreased, you have all these symptoms. So the thinking is, if we replace these hormones, then you prevent the woman from suffering from all of these symptoms. However, there is a risk. There are the benefits, as I said. The benefits is that women suffering from these symptoms, they will have alleviation of these symptoms, and these symptoms can actually cripple women sometimes. And so to get the hormone replacement therapy, that makes them feel really good, put them back in a place where they feel like a woman again, they feel like human again. But on the other side, there is the risk. Replacing the hormones have a risk of that individual getting breast cancer, getting uterine cancer, getting blood clots, and even strokes. And so this is why half of the medical fraternity, they're worried about replacing the hormones, whereas the other half is saying, we can't have women suffering, so we need to give them back the hormones. So it is important for you to have that conversation with your physician. And you sit down with the physician. If they recognize that, wow, this woman cannot work. Every day she goes to work, she's sick, she has to go back home because of the symptoms that she's experiencing. Then you may want to sit down and say, hey, let's start you with some hormonal therapy, but let's start with the lowest effective dose that can help you. Another thing is, if a woman has her uterus, it's going to be different from a woman who do not have her uterus, because if the woman has had a hysterectomy, then she's not at risk for the endometrial cancer. So then hormone replacement therapy may be better for her than for someone who has their uterus still.
So what is available hormonal intervention treatment, if I may say? What kind of non-hormonal treatment is available, and how effective, if any, and if so, are they effective?
Okay, I'm going to start with the lifestyle modifications because that is very, very effective. There are some types of foods that make menopausal symptoms worse, such as spicy foods and caffeine and alcohol. Those foods will make the menopause worse. So if you start removing certain foods from your diet, such as those, that can improve menopausal symptoms. Also, exercise. If you engage in regular exercise, that will help to boost your mood, decrease irritability, improve your depression. So a change in your lifestyle will definitely help. But now, some of the non-hormonal stuff. It depends on what symptom is bothering the patient most. For example, if a woman is having vaginal dryness, and that is really bothersome to her, that's preventing her from having intimacy, then you can give that woman some non-hormonal lubrication. So she can lubricate herself, lubricate the vagina, and that will make the sexual encounter more pleasurable, and she will not have to think about the hormones. There's some hormonal stuff such as black cohosh and soy isoflavonoids that some persons say they work, other persons say they don't work. Also primrose oil. I have my patients on a couple of these things that the patient come back, that didn't work, that was a waste of money. And another patient say, well, it didn't help with the vaginal dryness, but it helped with the hot flashes. And so many times patients have to try out certain things with the guidance of their physician. There's certain medications that are not hormonal, like something called gabapentin that is used for persons who experience seizures. And that is very good for patients who are experiencing hot flashes.
Now very quickly, to either of you, because I find there is this, like I said last week, for those of you who were on last week, there is this reluctance for people to, walk into a drugstore and pick up condoms, pick up, something lubricant, etc. Can you speak to some of these? What a man who is experiencing, I don't know which one of you said in response to a question that maybe the husband can say, can we try this, can we try that? No, he can't say that if he doesn't know. So educate the men for me, please. What are some of the things that can assist with maybe vaginal dryness or whatever else?
Okay, I'm glad you asked that question, Pastor Greene, because when a male doesn't have the understanding of the menopausal process, and that is a natural biological process, he feels like, honey, no, I think you're supposed to be producing this all on your own. I feel awkward using these creams, using these lubricants. It's not natural to him. It's not something that he is accustomed to. Could you imagine a man has been married for 40 years and a great part of that marriage, the woman was very lubricated and sex was easy. And now he has to go to the drugstore to pick up some kind of lubricant because every time he tries to have sex with his wife, it's very difficult for penetration because of the dryness, and the female experiences a lot of pain and has to interrupt that process. So the knowledge is key. The knowledge is power. We have to let our men know it is okay. It's a part of the physiological process, and the things that we can do to help, you help. Another thing that you asked, Pastor, in terms of the medical implications of the decrease in hormones, the men have to be willing to say, okay, let me go to the doctor with you because you may be at risk for cardiovascular disease. You may be at risk for a stroke or a heart attack. And that is true. But it starts with the knowledge. So men, do not be ashamed. Go out and buy your lube. Discuss it with the females. You guys sit down and discuss it together. There's some that have flavors, some that don't have flavors, some that the woman it may cause irritation to the woman, some may not. So it has to be a conversation, and it's a different journey, another journey that in life that you guys have to take together.
Now, Yes, go ahead, Dr. Garway.
Now, just to add something to that, though, with regards to the lubricants, it's been generally advised to use water-based lubricants because you could have an oil-based lubricant.
That's correct.
So generally, water-based lubricants are basically more advised, more encouraged to use. It's better.
But could you folks give some examples? I thought you were going to give examples. What are some of the safer?
The perfect one is KY jelly. And Doc brought in the very important point. Water-based as opposed to oil-based, okay? So there's lots of KY jelly out there. Go to your pharmacy and you just pick up a tube. That's the safest. That's the safest one. It has been around for a very long time and it works. Can't tell you how much to use. It depends on the female's body. It depends on the connection with the male and female. But as you continue to use it, you'll have an idea of how much you should use. Sometimes you use less, sometimes you use more.
Well,
so KY jelly, Pastor, KY jelly.
Yeah, we're out of time. I really want to thank both of you for sharing. I'm very happy, Dr. Garway, that you were on, because it's always good to have. I believe you came to support the men. That's good. Just to say that next week again we are going to be talking about breast cancer. As I indicate, we're going to have an oncologist. We're going to have a surgeon. Hopefully to guide us through some elements. There are lots of misconceptions about breast cancer. You need to hear. Following that, we're going to be talking about the following week. I think we're going to be talking about infertility and the implications. So we have some good stuff lined up for you. Keep listening to Let's Talk, 3 p.m. Atlantic Standard Time every Saturday afternoon. To those of you who are listening, I just want to announce that following this program on SLC Adventist, if you're listening on SLC Church channel, following this program on SLC Adventist, we're going to be having what is it again? The Bible Connections. The last time there were some challenges with the Bible Connection, so they're going to be going again. So we want you to bear that in mind, and you can connect and join. And for those in South Leeward, the word is support Tyrese. Ty Johnson, who is representing South Leeward Conference. But thank you so much, both Dr. Garway, Dr. Stevens, for sharing, and Let's Talk. I suppose that there may be a question or two that we did not get to from the listeners, and lots more that we could say, but we're out of time. That's all for now. May God bless you. Until next week.